Welcome back to The Blend. It's estimated that more than 11 million people are living with chronic obstructive pulmonary disease, or COPD. And with today being World COPD Awareness Day, we want to shed some light on the condition and how to manage it if you're living with it. Lead physician for OptumCare COPD Clinic, Dr. Suresh Tani, who joins us now. It's great having you, sir.
Nice to meet you.
Nice to meet you.
Yeah.
Welcome in. We hear COPD a lot in commercials and stuff like that. Explain what COPD is.
COPD stands for Chronic Obstructive Pulmonary Disease, and it is caused by there's an inflammatory disease, a chronic inflammatory disease of the lung, and there's obstruction to airflow from the lungs. COPD is a common disease. It's a preventable and it's a treatable disease. And as you mentioned, the COPD affects millions of Americans, and actually estimated 26.8 million people have COPD.
Wow.
And out of which only 14.8 million have been diagnosed.
So the rest are just living with it and don't realize
Don't
that's
even.
what they have.
Approximately 12 million people don't even know they have COPD.
Wow.
And COPD, the damage that occurs to the lungs is irreversible.
So if you don't catch it early, you're doing permanent damage.
That's
and
correct.
You can't reverse that permanent.
That's correct. So that's the reason today, being a World COPD Day, we want to bring the awareness of this disease so that we can improve the prevention and the treatment of the COPD disease.
Yeah, and people might not realize exactly how serious this is. This isn't just a shortness of breath. This is the third leading cause of death in America.
Of course, and it's the fourth leading cause of disability in America.
Wow, no kidding. So, all right, let's say we want to catch it before it gets super serious. What symptoms should we be on the lookout for to be able to catch this and nip it in the bud?
I mean, symptoms of COPD are shortness of breath, which particularly gets worse with activity, wheezing. You have a chest tightness, cough with a mucus production. People can have a blue discoloration of their lips or fingernails. That is called cyanosis. People can have a swelling of the feet or ankle also. And some of the people with COPD also have a flare-up of the COPD. That is called exacerbation of COPD. And during this flare-up of COPD, people have more increase in symptom beyond the day-to-day variation. What does it mean is, they're going to have a more shortness of breath, more cough, more sputum production.
So worse than it typically is. Yeah.
That's typically.
Is this just something that smokers have to deal with, or is COPD beyond just smokers?
I mean, COPD can be occurred by secondhand smoking too, like secondhand smoke.
Especially here in the Valley, I mean, there's
correct.
so many people that work in the gaming industry. Yeah,
that's correct. You can also get by exposure to the air pollution, and people also who have industrial exposure to gas, fumes, vapors, that can also cause COPD. And also there's one genetic disorder called alpha-1 antitrypsin deficiency, which can also cause COPD, even the person has not smoked cigarettes.
So even if you've been sitting in a bubble your whole life, you could still have COPD.
That's correct.
My goodness. OptumCare, you have a COPD clinic. Tell us about this clinic and how it's geared to help patients that are living with the disease.
The OptumCare COPD clinic, in this clinic we have one physician, we have one case manager who's a registered nurse, we have a respiratory therapist, and we also has a medical assistant. So what we do in the COPD clinic is, first thing is to educate the patient about the COPD. We also try to make an early diagnosis of COPD. We also treat the patients with appropriate medication, as well as other modalities like oxygen, pulmonary rehab. We also try to prevent this flare-up of COPD that I was talking earlier.
Of course.
And also so that we can prevent the hospitalization for these patients. And we also make a telephone calls to these patients who have a high risk for admission, so that we can prevent the hospitalization.
And you mentioned that you want to be able to say that this is COPD as early as possible.
That's correct.
Because a lot of people, they might be misdiagnosed. They might not realize it's COPD, what they have, and then it goes down the line, it gets kicked, the can gets kicked down the road,
correct,
1, 2, 3 years.
Yeah.
And you've done irreversible damage to your lungs during
That's
that
correct,
time. Wow, it's very important stuff. Where is this clinic located? This
clinic is located at 4750 West Oakey Boulevard, Suite 1A.
And we'll have the addresses available right there on your screen. There you go. There in Las Vegas. And the phone number and website as well. You've been in the Valley now for many, many years. You've been a doctor for more years than that. Is COPD, the numbers increasing, decreasing? Where are we here?
COPD, if you look at as I mentioned earlier, there are like 26.8 million people, who have a COPD. Now, because with the aging population and people are still smoking cigarettes, it is estimated that about 15% of people living in the United States still smoke cigarette.
Yeah.
So with aging population,
That number's gone down significantly, but it's still not as low as we'd like
yeah.
it. Yeah, of course.
So
there's room to grow there. Doctor, it's great having you. Thank you so much.
thank you, sir.
Pleasure.
Nice
Hey, listen, Optum Lung and Allergy Care, COPD Clinic. It's 4750 West Oakey. It's right near Decatur. Their website and phone number are right there on your screen. Optum Lung and Allergy Care is a proud sponsor of the Morning Blind.